Hi, I'm Alex Howard. I'm here with Julie Alderman from the nutrition team at the clinic. And today we're going to be talking about the role of toxicity and detoxing in ME, chronic fatigue, fibromyalgia and that group of illnesses. Now, if you're watching this, there's a good chance you may have seen, for example, our report ME in the 21st century, where we talk about a detox subtype as being a predisposing factor in getting ill. We also talk about toxicity as potentially being a trigger, so one of the kind of things which is like the final straw on the camel's back. And also in other places you may have heard us talk about how toxicity can be a block to recovery. So this is obviously a big factor in a lot of different ways in ME chronic fatigue. And maybe a starting point is what toxins actually are and what sort of toxins people can be exposed to.
Mm-hmm. So when we talk about toxins, it's really anything that's going to affect how our cells function. So some toxins the body produces naturally as a byproduct of metabolism, but the ones that we're really concerned about are the ones that we're exposed to in our food, our water and the atmosphere and environment around us. So for example, things like pesticides, heavy metals, trans fats, these types of things that all have a really damaging effect on cell function.
Okay, and how do people become toxic in the first place? Because obviously, you know, we're all being exposed to toxins all the time, but for some people this can become a really significant factor in the illness. So how does that come to be?
Yeah, I mean, someone will become toxic if they have had a specifically large exposure to a toxin, but also if the body just can't actually process the toxins in the way that it should. So for example, if there's a genetic weakness, so the liver enzymes are working slower than they should be, or if the whole system is slightly depleted and weaker, so for example, if there's a lot of mitochondrial dysfunction and reduced cardiac output, then there'll be reduced blood flow to the organs, reduced blood flow to the liver, and things like that. Also, there's a lot of problems going on with the gut, and there's parasites, yeasts, and pathogens that are producing toxins that can also have a really large toxic load on the body as well.
And if any of these things are going on, what are some of the symptoms that somebody may experience with, with too much toxicity in the system?
I mean, classic symptoms would be things like brain fog, not being able to concentrate, having reactions to perfumes and chemicals, perhaps to specific supplements as well. So
obviously it can affect people in a whole range of different ways. I mean, obviously the body should be able to deal with a certain amount of this by itself, and as you're saying that sometimes that process can get interrupted.
Yeah.
But what's the way that the body should be dealing with it? I know that, for example, the liver is supposed to be particularly key with this.
Exactly, yeah. The liver is the primary organ for detoxification, so it filters the blood and helps to remove the toxins. And there are two key phases that work. So phase 1, which essentially will take the toxin and bag it up, and then phase 2 will take the bag out, so it can then be excreted. And if the two pathways are out of balance, that can cause problems too. So if phase 1 is working too fast and you've got a build up of these rubbish bags that aren't then being taken out by phase 2, that can also cause problems.
Okay, and so if people have got potentially toxicity build up and that kind of thing, how do we know? I mean, what are some of the ways we may test for this, for example?
Well, the type of test that we would use would depend on what type of toxin we expect the person has been exposed to. So if we're looking at heavy metal exposure, we might look at doing a hair mineral analysis, for example. If you think it might be an organic solvent that's affecting the mitochondria, then we'd look at doing a mitochondria test and seeing whether there's a specific toxin bind to the translocated protein. And we can also do other tests to see whether the detoxification enzymes have been affected. Also neurotoxin tests. So yeah, the test would really very much depend on the type of toxin that's been exposed.
So I mean, it sounds obviously incredibly patient specific in terms
Absolutely.
of finding out what's going on, but once we've got an idea of kind of what the toxicity is and how it's impacting somebody, maybe an example of the kind of thing you would do about it. So obviously we cover all the different kinds of toxicity, but an example of one of the ways you would actually treat it and work with it.
Yeah, so for example, if someone had exposure to heavy metals, the way the metals often work is they displace specific nutrients on key enzymes. So if someone has had a high level of nickel, for example, then we could give in a zinc supplement which would help to displace the nickel, and then would also give other support to make sure the nickel is then actually taken out of the system. But if someone else had exposure to a lot of neurotoxins, then we'd have a very different protocol which would be focused on making sure we've got the right fats going in there to exchange them.
Well, I think the interesting thing is that a lot of people with ME and chronic fatigue will have realised they had some toxicity and may have done a general detox, which may have helped a certain amount. It may actually have just released more toxins into their system and may actually make them feel worse. And I know that a lot of people that come to the clinic have tried detoxing. Actually, it's either not worked or it's actually made them feel significantly worse. And what you're saying that's really interesting is that this is very patient specific, and there's not just one thing that you would do. No. It's finding out what kind of toxicity it is and then specifically working with that, and I guess also taking into consideration different people, how they react to different supplements, what else is happening in their life, and the bigger picture of their case as well. So brilliant. Well, thank you, Julia, and thanks everyone for watching. And if people want to find out more, then as always the best way is to, after getting a free information pack, to arrange a free 15-minute chat with either Julia or one of the nutrition team, where you can get your specific questions answered. So thanks for watching, and we look forward to talking with you again very soon.